Okay, welcome back. This time around we are still looking at electrical stimulation, but we're going to set parameters on the Chattanooga for neuromuscular electrical stimulation, or NMES. So from our home screen here, we're going to select our electrotherapy. Then we are going to select symmetrical biphasic again for NMES on this unit. On one of our other units, it actually says NMS, but we're still using a symmetrical biphasic waveform, so we're going to select that parameter. We're going to hit the edit button, and then it brings you to this parameters menu here. So when we're looking at neuromuscular electrical stimulation, we have to consider the size of the muscle that we're treating. So whenever we're looking at a small muscle, something like facial muscles, maybe some of the forearm muscles, we want the phase duration to be a little bit lower. So we can set this from the range of anywhere from 125 to 200. And if you notice, again, it goes by increments of 20. So we want to be at least above 120, but we can set it all the way, let's just say at 200, kind of the high end for a smaller muscle. Then we're going to have to set the frequency. So the easy way to think about this is if you look at your parameters, for regardless of the muscle size or for whatever goal you're trying to accomplish with this, the frequency can be right in the middle of those parameters, and we can set it at 50. So we have, for a small muscle, a phase duration of 200 microseconds, and then we have our frequency set at 50. And this can go anywhere from 30 to 80, but again, right in the middle at 50 is going to hit all of the correct parameters for whatever goal you're trying to accomplish. So now let's talk about this side over here, and then I'll show you how to set it for a large muscle. So for NMES, the thing that we really have to consider here that's a lot different than something like TENS is we need a on-off cycle, so it cannot be continuous this time around. So let's just kind of talk through this one. If we're going to use this on-off cycle of 5 to 5, so that just means 5 seconds on, 5 seconds off, we would consider that to be a 1-to-1 ratio. So we can use something like a 5 second on, 5 second off for somebody who has muscle spasms, or if we're trying to reduce edema, let's say in the lower extremities. So you can use that 5 to 5 or that 1-to-1 ratio for those purposes. We can also set it, this is still a 1-to-1 ratio, 10 seconds on, 10 seconds off. Again, that would be appropriate for somebody with muscle spasm or if we're trying to reduce edema. We're just getting more contractions within this 20-minute period here when using a cycle time like this. If we want to go for strengthening, pure strengthening, then this is the common setting that we're going to use. So this is a 10 second on, 50 second off ratio, or a 1 to 5 ratio. Okay, so when we're utilizing this 1 to 5 ratio, the contraction is going to last for 10 seconds, but then we get a significant off time. So we actually let that muscle recover before it goes through its next strong contraction period. Okay, so we're going to leave the cycle time there because that's what we're going to do most in our clinical setting is strengthening. But let's say now we wanted to switch from a small muscle group where we have the phase duration set at 200 to a large muscle group like the quadriceps. So we're going to change this phase duration to at least 300. And remember that we can go anywhere from 200 to 350 for this phase duration. We don't have to set anything different for the frequency. We don't have to set anything different for the cycle time. We are ready to go.